Hello, this is Dr. Alan Menter. I'm the chairman of the Department of Dermatology at Baylor University Medical Center in Dallas. I will be discussing Secukinumab demonstrates significant improvement of disease activity and health-related quality of life in Canadian psoriasis patients in a real-world setting. This poster was presented by Dr. Poulin and colleagues at the 76th annual meeting of the American Academy of Dermatology on February the 16th to 20th, 2018, held in San Diego, California. A summary of the study. This real-world trial involved patients with moderate to severe psoriasis treated with Secukinumab who enrolled in a patient support program in Canada. The majority of patients were biologic naive or had received only one biologic. Treatment with Secukinumab demonstrated significant disease reduction and improved quality of life. How important is this study? This real-world trial in Canada confirmed efficacy and quality life of improvements with Secukinumab that was also reported in clinical trials. Trial participants were those enrolled in a patient support program for the treatment of moderate to severe psoriasis. The program provided reimbursement support, access to educational tools, injection training, and supplies. Data were collected for patients who provided consent and received at least one dose of Secukinumab. The post-Secukinumab Psoriasis Area and Severity Index, in other words, the PASI data, and the Dermatology Life Quality Index, the DLQI, were limited to those whose scores were collected 12 to 51 weeks post-treatment initiation. If multiple scores were available, the ones close to the Secukinumab start data were used. So let's now talk about the key findings of this study. 2,216 patients were included with an average age of 50.3 years, with a range from 18 to 92 years. 42.6% were females. 35.2% were biologic naive. 29.6% had received only one biologic agent previously, and 18.8% had received two biologics previously. For the 1,435 patients who received one biologic previously, 38.3% received Ustekinumab, 30.0% adalimumab, 18.3% etanercept, and 8.1% infliximab. Post-Secukinumab's PASI data were available for 108 patients. Their treatment history was similar to the overall cohort of the original 2,216 patients. From a mean baseline score of 18.2, the PASI score decreased to 3.0 following treatment with Secukinumab. A PASI less than 3% was achieved in 68.5% of the patients overall. A PASI less than 3 was achieved in 83.8% of biologic naive and 60.6% of patients who had had prior biologics. Pre- and post-Secukinumab DLQI data were available for 236 patients. The Dermatology Life Quality Index score changed from a mean of 19.1% at baseline to 3.6 following Secukinumab treatment. 92.4% of patients achieved a DLQI reduction greater than 5, or a DLQI of 0 to 1. So what are my thoughts related to this study? I think it's an important study because it's real-world data. I think this study allows us in clinical practice, all of us dermatologists in clinical practice, to try to assess quality of life issues in our psoriasis patients. It's not something that is frequently done in clinical practice. It's done in clinical trials, DLQI, and whereas DLQI may not necessarily be specific for psoriasis, it's the one Dermatology Life Quality Index that has been used in all our clinical studies and was used in this study. And we'll be getting new quality of life indices for us to use in clinical practice. In other words, psoriasis symptom index, where we take 8 symptoms, itch, stinging, burning, etc., and ask the patient to rate them on a 0 to 4 basis. So the maximum would be 32. And we've done a study internationally with our International Psoriasis Council group to show that this is a validated new index that we can share with our patients. So how did the study, again, results of the study impact the future state of patient management for us in clinical practice? I do believe that studies like this, real-world studies, over 2,000 patients, will allow patients with moderate to severe psoriasis to feel more comfortable with the understanding of the nature of their psoriasis, as well as improving their relationship with dermatologists. Because so many of our patients will say to us, "Doctor, you're treating us with a drug that's going to suppress my immune system, cause cancer, cause infections." And I always say to them, with drugs like Secukinumab that we are using, we are no longer suppressing your immune system, we are modulating it. And I give them a little card that says modulate means bring back to normal. So we are taking out one single, I use the term chemical aesthetic cytokine, IL-17, out of your immune system that is increased and bringing it back to normal and leaving the rest of your immune system intact, which allows us as dermatologists to reassure our patients that the results from clinical studies like this allow patients to feel more comfortable with initiating a drug like Secukinumab. Thank you very much.